Okay, so prior to meeting with my client, the first thing I would do is review the patient's chart for any significant findings, such as a previous diagnosis or allergies, current diet restrictions, mental status, or medications. Then I would ask the patient's nurse or CNA what happens when they swallow pills or sip water. Are there any problems with that? And then I would go see my patient. So I'd say, "Hi, I'm Maggie Fitzgerald. I'm a speech pathologist here. Your doctor referred me to come in and check out your swallowing since you've had pneumonia. So he wanted me to see that everything's functioning properly so he can make sure your diet is least restrictive as possible. I spoke with your nurse and she said that sometimes you cough on your water. So what I'm going to do is just confirm some information, and then I'm going to have you drink some water and eat some foods for me. Does that sound good?
Sounds good.
Okay. So can you just confirm with me your name and your date of birth?
Justin, July 18th, 1990.
Okay. And then I'm just going to check his medical bracelet or his intake form to confirm that I'm working on the right client, or to check his mental status to make sure that he's alert, responsive, cooperative, make sure he's not confused, etc. Okay, Justin, before you came to the hospital, have you had any swallowing problems that you know of?
Sometimes just swallowing like water and.
Okay. And when you have problems, what were you seeing?
Just like some coughing.
Okay. At home, do you feed yourself or do you depend on someone else to do so?
Nope. I feed myself.
Okay. And in your file, I read that you have some acid reflux. Are you taking any medications for this?
Yeah. My doctor told me to take Prilosec.
Prilosec. Okay. Have you found that that's eased any of the symptoms or stopped the symptoms?
Yeah, it works most of the time.
Okay. And when you swallow foods, do you ever feel it sticking anywhere in your throat or chest, or stopping anywhere?
Like every once in a while. Yeah, sometimes.
Okay. Can you point to me where it stops?
It's usually like closer towards like the bottom of my throat. Like
okay.
Okay.
Is there any pain associated with this?
Just a little bit, yeah.
Okay. On a scale of 0 to 10, how much pain would you say you feel?
It's not painful. It's like a 3.
Okay. So you're aware that it's there, but it's not very harmful.
Correct.
Okay. And when did it start?
A little while ago, maybe like a year, but I don't know. Never really thought it was like a big deal.
Okay. Have you ever had any previous bouts of pneumonia previous to now?
I think I had pneumonia when I was like a kid.
Okay, but not recurring. You don't have it usually.
No, not anything previously.
Okay. Do you have any allergies?
Not that I know of. No.
Okay, good. So, during this time, what I observed was that he's not drooling. He has a closed mouth posture at rest. His breathing seems normal and through his nose. And then I'm going to go ahead with the oral mechanism exam. Okay, so to start, I'm going to look at your lips. I'm going to have you make some faces, just to see that everything's functioning properly. So starting with your lips, can you pucker your lips for me?
Like a kiss?
Yes. Okay, can you smile? Good. Now can you pucker and smile alternating? Okay, good. Can you say ma 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 for me?
Ma 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 ma.
Okay, can you hold some air in your cheeks? Good. I'm going to push on this. I want you to hold it in. Okay, good. Now I'm going to look at your tongue. Can you lick your lips for me, please? Okay, good. Can you stick your tongue out? Good. Can you go side to side? Good. Can you go up? Okay, good. Now I'm just going to see the strength of your tongue by having you push my tongue depressor. So can you stick your tongue out? Good. Can you push against this? Good. And I'm going to go inside. I'm going to go inside. Open your mouth. Stick your tongue in, open your mouth. Good. Can you push against the side on? Okay, let me have you do the other side. Okay, good. Very good. It's cherry flavored. Okay, can you say la 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 for me?
La 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 la.
Good. can do ga 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 ga.
Ga 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 ga.
Good. So there I'm looking at the alveolar contact and the velar contact. And I'm going to look at his jaw. Okay, can you open and close your mouth for me? Keep going. Good. And now I'm going to push against your jaw, and I want you to do the same thing. Good. All right, now I'm going to get a look inside of your mouth. Give me 1 second to get my light. Okay, open your mouth. All right, stick your tongue out and say ah. Good. Okay. So here I'm looking at his dentition to see if there's any decay or dentures. As far as the soft and hard palate, I'm making sure that everything's okay there. That his velopharyngeal movement's normal. There's no deviation or hypernasality. Okay, as far as your larynx, can you clear your throat for me? Good. Can you cough for me? Okay. Give me 1 second. Okay, can you swallow for me? Okay. Good. And then can you do an upward pitch of ooh?
Ooh.
Good. Okay, Justin, so I'm going to have you try a few things for me today. I brought you a few snacks that I was going to have you try eating, and I'm going to see how well you swallow. If you feel any pain or discomfort that you usually feel, please let me know, okay?
Okay.
So first, this one's just water. I'm going to have you take a small sip of water. Now say ah.
Ah.
Okay, good. So by having him say ah, I'm looking to see if he has a wet or gurgly voice quality. Now I want you to take a normal sip of water. Okay. I'm going to have you do it again. One normal sip size of water. Okay. Now I'm going to have you do it one more time. Okay. Maybe some water. I'm going to have you do it again. I want you to take one really big drink now, okay? Okay. Thank you. This time I'm going to have you take a sip with the straw. Grab the straw. Here you go. So I'm going to have you take a straw. Normal sip. Okay. So this one is a little bit thicker. Still water. It's not supposed to distort the taste, but sometimes the texture might feel different. So I'm just going to have you take a sip again. Okay. Now we do it one more time. Okay. I'm going to have you do it one more time for me, okay? Okay, I'm going to have you do it one last time with the straw again. All right, this last one's a little bit thicker than the previous one. Same thing, I'm going to have you take a sip. Okay. I'm going to have you do it again. I'm going to have you do one more time. Last time, I'm going to have you do it through the straw one more time. Good, I'll take that from you. All right, this time I'm going to have you take a bite of the applesauce. So here I'm just watching his lip seal, how long it takes him to swallow, confirming that he swallows it instead of pocketing it. There you go. Okay, can you take it one more time? Okay, good. Now I'm going to have you take some peaches. Okay, good. I'm going to have you do it one more time. Okay. And I think this is the last round. I'm going to have you take a cracker. I want you to chew. Let me know when you're ready to swallow. Go ahead whenever you're ready. Okay, good. Can you open your mouth? Good. Okay, have you do it one more time. Let me know before you're ready to swallow. Okay, can you open your mouth? Okay. So I'm looking for a cohesive bolus. So whenever you're ready. Good. Okay, Justin, so I'm feeling some slight weakness and some reduced elevation of your laryngeal structures. And I'm seeing some signs of aspirations. Aspiration, what I mean by that is that you're coughing, your eyes are watering, you're clearing your throat a lot on thinner liquids. And what aspiration is that your food or water are going into your lungs instead of into your stomach. So what I'm going to do is I'm going to put you on a honey thick liquid diet. Your regular meals, your regular food can be swallowed just as normally. But I'm going to do this until we get a modified barium study, which is under x-ray, which I can explain to you. But are you comfortable with going ahead with the study so that we can get a look at what's going on, see if you're fully aspirating on your food or your drink, or whether it's your reflux and we need further consultation?
Yeah, sounds good.
Okay, sounds good. From here, I would talk to the physician, let him know that there's some overt signs of aspiration on thin and nectar thick liquids, and see if she's okay or he's okay with the MBSS. With this, we would also probably, because he has reflux, we would probably look for an ENT or a gastroenterologist, or talk to his regular physician about the possibility of him aspirating out his reflux as opposed to his full food following the study.